Welcome to Train the Trainer for the Stroke Education Toolkit targeting school-aged children. This program has audio that will require speakers or headphones. This program is divided into two main parts. The first part provides a trainer with basic information regarding the nervous system, how to recognize stroke, and what to do if you recognize a stroke. This will serve as a base of knowledge that will allow the trainer to successfully educate their audience regarding these issues. The second part of this program is an explanation of how to utilize the toolkit for the Youth Stroke Education Program. This is a training video for teachers. There's a separate PowerPoint presentation in the toolkit for educating students. Why focus on children? According to the 2012 Current Population Survey, about 4.2 million households had children under age 18 years old, and out of those households, 67% were maintained by grandparents. With a spike in children living with grandparents, education for stroke symptoms is essential. Strokes can occur at any age. In fact, nearly 1/4 of strokes occur in people under the age of 65. Finally, stroke recognition is poor and presents a barrier to acute stroke treatment. Next, we'll talk about the nervous system and blood supply, which will give you a foundation for stroke education. The nervous system can be divided into two main parts. The central nervous system, CNS, consists of the brain and spinal cord, and the peripheral nervous system, PNS, consists of the nerves and their communications with muscles and sensory receptors. The brain consists of the cortex or cerebrum, the cerebellum, and the brainstem. The brain is connected to the spinal cord through the brainstem, and the peripheral nerves connect the brainstem and spinal cord to the muscles and sensory receptors. The two systems interact and communicate as one continuous whole. Introduction to blood-brain supply. Your brain controls all the functions of your body, including movement, thinking, talking, breathing, and the beating of your heart. Your brain receives a constant supply of blood that is filled with oxygen and nutrients needed to keep your brain healthy. This blood is supplied by blood vessels called the carotid and vertebral arteries. These vessels are located in your neck and brain. Next, we'll discuss types of a stroke, how they differ, and why quick recognition is so important. A stroke is the rapid loss of brain function caused by some type of disturbance in the blood supply to the brain. As a result, the part of the brain that does not receive blood starts to die. An ischemic stroke occurs when blood vessels become blocked. This blockage can be caused by plaque buildup over time, atherosclerosis, or due to a blood clot that breaks loose and travels through the blood vessel and eventually becomes stuck in a smaller blood vessel. Once this blood vessel becomes blocked, any healthy brain tissue past that point does not receive the oxygen and nutrients it needs to live, therefore it will die. A transient ischemic attack, frequently referred to as a mini stroke, is caused by a temporary blockage of blood flow in the brain. TIAs and strokes have similar symptoms, such as paralysis, sudden weakness or numbness, vision dimming or loss of vision, slurred speech, and mental confusion. Unlike a stroke, the symptoms of a TIA can resolve within a few minutes or up to 24 hours, and there is no permanent brain tissue damage. Having a TIA is a risk factor for eventually having a stroke. A hemorrhagic stroke occurs when a blood vessel breaks, causing bleeding either within the brain, intracerebral hemorrhage, or around the brain, a subarachnoid hemorrhage. Intracerebral hemorrhage is often related to uncontrolled high blood pressure or hypertension, a blood clotting disorder, or an abnormality of a blood vessel that supplies the brain with oxygen and nutrients. A subarachnoid hemorrhage is most commonly caused by trauma or the rupture of an aneurysm, a weakening of a blood vessel wall. We've discussed the nervous system, how a stroke occurs, and why we should act fast. Now let's talk about the signs and symptoms to help recognize a stroke. Any sudden inability to function normally may be the result of a stroke. A sudden weakness or numbness, usually on one side of the body, face, arm, or leg. sudden slurred speech or inability to speak normally or comprehend what is being said, sudden loss of balance or inability to walk, sudden loss of vision or double vision. A helpful mnemonic to remember this is act fast. F stands for face. Does their face droop on one side? Do they have an uneven smile? A stands for arm. Is one arm weaker than the other? Does one arm feel numb? S stands for speech. Is their speech slurred? Are they having difficulty speaking or trouble understanding what is being said to them? T stands for time. Call 911 immediately. Don't drive yourself to the hospital or delay by calling your healthcare provider first. Look at the time. Note when the stroke-like symptoms begin so you can tell the emergency department staff.
Every 45 seconds, someone in the US will have a stroke. How they or the people around them respond in those first moments may make the difference between a permanent disability and normal function, or even life and death. Hello, my name is Dr. Alex Gransveld, and I am the Co-Medical Director for the Centara System Stroke Program. This informational video is part of our Save the Brain campaign, because when a person is having a stroke, every moment counts. Time is brain. An ischemic stroke occurs when a blood vessel feeding the brain becomes blocked by a clot or a piece of plaque that has broken off the wall of an artery. Oxygen and glucose, the currencies of energy exchange in the brain, can no longer reach the brain cells, called neurons. It only takes a few minutes before some of the cells supplied by the blood vessel begin to swell, fail, and then die. The longer the blockage remains, the more cells that will die. Given enough time, all the neurons that were fed by the blocked blood vessel will die, and a permanent neurological disability will result. The only hope for a better outcome lies in the possibility of unblocking the blood vessel in those crucial early moments before all the cells have died. Fortunately, therapies now exist that give doctors the tools to help unblock those blood vessels. One is a medicine called TPA, or alteplase, that when injected into the body finds and literally dissolves the clot. The other tool is a device that is attached to a catheter that can be fed up to the blocked blood vessel and used to pull out the clot. The key to the success of both of these therapies is having them applied as soon as possible. Because there is a limited time after which the neurons are irreversibly lost and therefore the therapies will be of no use, it is essential that the stroke chain of survival is implemented effectively. So remember, time is brain because every moment counts.
Now that we've reviewed some basic information about strokes, let's see what's in our toolkit. Lesson plan. The lesson involves pre-testing of knowledge about stroke, an interactive PowerPoint presentation about the nervous system and strokes, a cartoon video teaching how to recognize a stroke, skits designed to role-play various scenarios in which someone is having a stroke and measures taken, post-testing, and goodies handouts. What you will need. The setting. You'll need a gymnasium, cafeteria, or church. This depends on the number of participants. The preparation. You'll need either a laptop with speakers, a projector with a screen, or a white paper canvas taped to the wall, as well as extension cords. For props, you'll need paper plates, utensils, a large cooking spoon, a medium skillet or pot, 2 aprons, 2 curly gray hair wigs, preferably short hair, hats, chairs, 1 large table, a phone, and a board game. A copy for each participant of the pre- and post-test and pencils, a copy of the fast flyer, how the brain works and symptoms of a stroke for each participant. In the following slides, we'll review the PowerPoint that you'll present to the children. The actual PowerPoint presentation is located in your toolkit. We will start with the content to be presented to the children, beginning with the 3rd slide. It's important that these slides provide a backdrop to the conversation and that you engage the children in a discussion as opposed to talking to the slide. This is the introduction to the nervous system. Ask kids if they want to see a brain. Show them the picture of the brain. Point out the different components and what they do. The brainstem is responsible for vital functions such as breathing, heart beating, and swallowing. The cerebellum gives you balance, helps you play the piano, and remembers how to ride a bike. The cerebral cortex tells you who you are, what makes you happy or sad, allows you to experience your world, and allows you to be good at sports. If you wish, you can also discuss the other components of the nervous system. Give the students the handout titled How Your Brain Works for reference. What is a stroke? On the next 2 slides, you'll explain how the blood is nourished and why the blood vessels are important. Point out the blood vessels in the picture. The next slide introduces the concept of a stroke. For example, that blockage of a blood vessel stops blood from getting to the brain and causes part of the brain to stop working properly. Here are some narratives you may want to use. What do we need to keep our brain healthy? Blood, oxygen, glucose or sugar. Blood vessels are important. They must be healthy to bring blood to the brain. If one of these blood vessels are blocked, then that part of the brain will not work properly. This is what happens when you have a stroke, usually caused by a blood clot or bleeding in the brain. Stroke prevention. On the next 2 slides, you'll discuss the importance of healthy living and how this helps to prevent a stroke. It's particularly important that this part is interactive. Ask the children if they know how to keep blood vessels healthy. Invite different children to offer one way. You'll be surprised by some of the colorful answers you might get. Keep it fun. What habits are good? Eating healthy, exercise, keeping hydrated, get plenty of sleep, low stress. What habits are bad? Don't smoke, do drugs, or drink too much alcohol. Stroke heroes. On this slide, you'll be able to play the Act Fast video. This cartoon demonstrates to the children in a fun way how to recognize a stroke and provides them with a mnemonic to help them remember.
Jenny and her grandma May on an ordinary day. From there in the kitchen, Grandma started to sway. Grandma sounded strange when she spoke, and Jenny had to ask, what if my grandma's having a stroke? I think I better act fast. I think I better act fast. Does her face look a little bit uneven? Does one arm drift down? Is her speech coming out kind of strangely? Then it's time to call 911. Jack and his favorite friends were having lunch in town. When Hank looked up, half his face drooped down. Hank wasn't making a joke, and so Jack had to ask, what if my buddy's having a stroke? I think I better act fast. I think I better act fast. Does his face look a little bit uneven? Does one arm drift down? Is his speech coming out kind of strangely? Then it's time to call 911. Helen and Bob were walking at their favorite time of day. Helen turned to Bob and said, my arm is not okay. Her arm was limp inside her coat, and so Bob had to ask, what if Helen is having a stroke? I think I better act fast. I think I better act fast. Does her face look a little bit uneven? Does one arm drift down? Is her speech coming out kind of strangely? Then it's time to call 911. Stroke can happen anywhere, morning, noon, or night. And every minute after that, more brain cells die. Our heroes acted quickly, and so they all have hope. Precious time and emergency care. You can beat a stroke. You can beat a stroke. Call fast for any sign of stroke. It's what you gotta do. Call fast
While displaying the slide, give the students the handout titled Symptoms of a Stroke for reference along with a fast flyer. Invite the children to express their thoughts about the video and answer any questions regarding it. Following this, ask for a volunteer to perform the ACT FAST exam on the presenter. Once this has been done, the PowerPoint portion of the lesson is complete and the fun begins with role-playing through skits. At this point, an area should be cleared for the stage and the children seated to view the skit. Media equipment should be moved aside as necessary. This transition process may take a few minutes, and one of the presenters can keep the children occupied with health-related discussions. Skit number 1. In this skit, we're emphasizing that sometimes adults make the wrong decision, in this case, wishing to rest instead of seeking immediate attention. Play the video on the next slide to see this skit in action, but remember, you'll be performing the skit live and not playing the video for the children.
I really like this game. This is really cool.
I'm gonna win. I win all the time.
I'm gonna win. You cheat. You always cheat.
Okay.
All right. I am an animal.
No.
Looks good, Grandma.
Grandma, are you okay?
Oh, no. What happened?
What's wrong?
Oh dear.
What?
Oh, there's food all over the floor.
I'm not feeling quite myself.
You want to go lay down, maybe?
Oh no, no, no.
That's not a good idea.
No, we watched a program in school
I think
today.
I'm
What was
going
that?
No,
Yes.
no, Grandma, wait.
sit down,
Sit
Grandma.
down
We were
first.
talking about stroke
Fast.
and a quick way.
Fast.
That's it.
Fast.
That's it. Fast.
Grandma,
Those
what
four
is
letters.
fast?
Those 4 letters. So
Say-
the F, I think, was for face.
Smile. Okay, her smile's fine.
Okay.
Her arm.
Can you put your arms out straight, Grandma?
Oh no.
Can you put your other one up?
Uh-oh. This is emergency.
Oh my gosh.
We need to call 911.
Oh my gosh. Hello, I have an emergency. My grandma, I think, is having a stroke. She can't hold her arms out straight. She's not feeling well. What should I do? Okay, all right. You're gonna send an ambulance? All right, okay. Yes, I'll stay on the line.
Skit number 2. In this skit, again we emphasize that sometimes adults make the wrong decision. In this case, delaying seeking treatment until after the game and continuing to drive, it is up to the children to be persistent under these circumstances and call 911. Play the video on the next slide to see this skit in action.
It's a big game.
Ah, no
That
way.
sounds great.
Give
Can we
me
get
pepperoni.
an extra cheese?
No,
extra,
no,
Extra.
I want the cheese. I want the cheese.
What did you say?
Did you say sausage?
Dad, are you
Did-
okay?
So for what?
Pepperoni and sausage.
What's wrong?
Hey guys, I think
man.
he's having a stroke. Dad,
Oh,
Dad, listen, I think you're having a stroke.
What are you talking about?
No, no,
you-
listen, this is
Do
an
you remember the
emergency.
class we were
What are you talking about?
You need to pull
No,
over, Dad.
no, I'm okay.
You're
So
so
Dad, we need to pull over right
I'm
now.
gonna call 911.
Please, let's get,
I'm gonna
yeah.
call 911.
Dad, please pull over.
Okay.
Oh my God.
Okay.
Yes, hi. I have an emergency. We're in the car and
I'm really okay.
my friend's dad is driving.
I think I'm okay.
I think he's having a stroke. His speech is funny. All of a sudden it was clear and then it just went, we couldn't understand it. Okay.
Yeah, okay.
All right. They're gonna send an ambulance.
All right.
We just need to wait.
I don't really think I'm having a stroke.
Can you see his face? Is it?
Yeah, it's crooked like this.
lopsided? Yeah. We need to try to get you to the hospital as soon as.
Hey, goodness.
Skit number 3. In this skit, we're demonstrating a mistake that is often made. When someone is having a stroke, it's not uncommon for them or a loved one to call their doctor instead of 911. This delays the opportunity for emergency treatment. Also emphasized in this skit is not to give anything to eat or drink if a stroke is suspected, not even an aspirin. Play the video on the next slide to see this skit in action.
Hi guys, how was y'all's day?
Oh, good. I think I blew my math test.
Really?
I know.
Oh, this is really good.
Thank you.
Did you make this?
Yes, I did.
Wow.
Slaved all day in the crock pot.
What's
for dessert?
Maybe
Maybe something chocolate.
Is it spicy, you said? What?
Dad, what are you saying? Is it that spicy? It can't be that spicy. Oh, hold on. Let's not. I think something's wrong. Maybe you shouldn't be eating right now. Maybe we should just call the doctor's office. We learned about this in school. We learned.
Oh, well, what did... Oh, wait a minute.
He's talking funny. He's talking funny.
He's not learn something about this in school?
I think he's having a stroke, Mom.
Oh, no. Well, what do we do?
We should call 911 right away.
Right away. Right away. We have to call. Don't you think?
Can I give him something to drink?
No.
Oh, okay.
Hello? Yes, ma'am. I think my dad is having a stroke. Yes, he's having slurred speech and he's not making sense. All right. Yes. Bye.
No. Let's not eat that. Has your face? It's not really unequal. Can you lift your arms up for us?
Your arms up.
Well, that looks great.
Say your name.
It's not talking right.
Something.
Yeah. It's not making sense.
After the presentation, do a wrap-up. Go over Act Fast. Give students the appropriate post-test according to their grade level. Emphasize calling 911. Don't drive, don't eat or drink food when having symptoms. Review Act Fast. When it's time for the post-test, first and second graders are best tested informally through communal review of questions. Grade 3 and above can be provided the written test. Play the video to see a communal review in action, but remember, you'll be doing it yourself.
Would it worsen if they had more than one symptom? Like if they had slurred speech and like their arms weren't straight up? Would it get worse faster?
It not necessarily wouldn't get worse faster, but it might be compared to a small stroke versus a larger stroke in the brain. Maybe taking more part of the brain cells. So like, you know, that little picture that we had there, it was just like a little tiny spot. You might get 1 or 2 little symptoms, but if it's a larger one, that's when you get more symptoms.
Is there a symptom that's worse than others?
No, they're all kind of equally the same in the emergent type of situation. Yeah, so all of them are bad.
I know you guys say that kids can get strokes too, but
Yes.
Is there like a certain age that most people get strokes at?
Yes, that's a wonderful question, actually. Yes, kids can get strokes, and usually around the year 70 is when we're seeing all the strokes. Women actually are outliving the men a little bit longer, so they might get them in their 80s versus 70s.
Person's blood can't clot. Are they immune to blood clotting caused strokes?
There's another type of stroke.
Yes.
There's 2 types. There's the type you think about as a blood clot where it goes up and blocks flow. And then if you had that problem that you're describing, sometimes you can have where a blood vessel ruptures. The same thing happens. Blood doesn't get to where it's supposed to be on the other end. So you can get a stroke from bleeding too. So you can have a clot form or you can have the bleeding type. So both of them are strokes.
Recommendations. Have fun. Be interactive. Don't be scared to ad lib. Be creative. Utilize volunteers. Thank you for joining the community of educators working to enhance recognition among our youth about how to recognize and respond to stroke attacks. Your efforts will save lives. We welcome your suggestions on how we may improve this lesson plan or stroke education in general.